5, 4, 3, 2, 1. Hello, everybody. Welcome to our newest episode of the Everything Medicare Podcast. I'm coming to you on Tuesday, May 22nd. Normally, as you folks know, the podcast comes to you every single Monday, but the past couple of weeks, Mondays have just been crazy here in our office, and I haven't had the time to come and do this podcast and grace you with my beautiful voice. Who am I kidding? So I apologize. This is the second week in a row. It's come to you on a Tuesday. We're going to do everything we can starting next week to have it Monday every single week. But hey, one day late is better than not coming at all. Today, we're talking about Tricare, veterans benefits, federal plans, and how people that have Medicare and these different programs can work with it, what their options are, what they have available to them. Now, this is a topic that most agents that claim to be Medicare specialists don't know anything about. I'll share a secret with you. Even people that taught me when I first got started in the Medicare business had no idea about this stuff. This was something I found out on my own. When I first got started in the Medicare business, the people that taught me everything that I know, and these are, people that work for insurance companies, reps, people that oversee sales for insurance companies, people that were there in a position to help me. They didn't know anything about this stuff. They would tell me early on that if I ever encountered somebody that had Tricare, federal plans, veterans benefits, that you can't do anything for them and to just run the other way. And that's what most agents do. If any of you have Tricare for life, for example, and you've ever spoken to a Medicare agent, a quote-unquote Medicare agent about this, you've seen that I'm willing to bet you lunch that they could not get off the phone with you fast enough, or they couldn't get you out of their office fast enough because they thought that there's nothing they can do to help you. Let me just put it bluntly, folks. Most people that claim to be Medicare specialists don't know half of what they need to know to be a specialist. The truth hurts. There is a lot of options that people on these programs have in the Medicare world. Now, before you say anything, a lot of you probably that are listening to this are probably thinking, well, Christian's just trying to get me to buy more insurance when I don't need it. Wrong! That is not what I'm trying to do. I'm trying to spell out that you have options. Options that don't cost you anything else. No premiums, not a penny out of your pocket, but you get extra benefits that Tricare doesn't give you. And if they do give you, it's limited, that the VA doesn't give you. And if they do, it's limited. And the federal plans don't give you. And if they do, it's limited. Stay with me into the second segment, and I'm going to talk more about these programs, how they work, and what does it have to do with you. Stay with me. Welcome back. This is segment 2 of the Everything Medicare Podcast, where every single week I come and I talk to you about your Medicare, your Medicaid, your Social Security, your retirement, and everything that has to do with the twilight years of your life. I'm Christian Brindle. I'm your host. And folks, I've been working with Medicare plans for, 5 years now, and I have dedicated my life to knowing everything that there is to know about Medicare, Medicaid, Medicare supplements, Medicare plans in general, and everything that's in that world. Most people don't have that type of dedication, and so they're not going to know everything that they need to know to point you in the right direction. Only someone that's immersed in this stuff, that spends all day, every day learning about it, that's constantly learning new things about it, and keeping up on the changes about it, can really give you a good recommendation. When you're on Medicare, whether you're already on Medicare and changing your plan, you need someone that's a true expert. Someone that knows this stuff inside and out, someone that spends basically all day thinking about it. I know you don't need to feel sorry for me. I feel sorry for myself. But it's the truth. And I'm not saying I'm the only person out there to work with, or my company's the only place out there to work with. There's other good places to work with, but I'd say 99% of insurance agents out there do not know half of what they need to know to give a good recommendation. Most people out there have one or two companies that they favor. If they're an independent agent, sometimes they're captive agents and they only have one company. And so you know that they're biased right off the bat. But even if an independent agent, a lot of independent agents fall in love with one or two companies and they'll recommend them just out of personal bias, even if it's not a good fit. Even if it costs someone $1,000 more a year in prescriptions. Even if it doesn't cover one of their doctors, they'll prefer that they change their doctor. You see a lot of snaky stuff, shady things. Stay away from these kind of things from anybody that you're working with. Run the other way. That's my opinion. You want someone that's going to be able to look at all the plans in a vacuum and throw all their biases out and find the best one for that person. Now, it's not a bad thing to take their experiences into consideration. That experience is how you know if a plan's going to take care of somebody or not, if they pay claims quickly, if they fight claims, if they're just difficult to work with. Those things matter. But it doesn't make it so two companies work every single time, or one company works every single time for people. It doesn't work like that. People have different needs and different preferences. I have happy clients on every insurance company you probably have ever heard of in the Medicare market, because they work for those people and they all have different needs than each other, and the different companies suit different people's needs specifically. And I'm going somewhere with this. This comes back into the Tricare thing, Tricare for life. Most agents just don't know what to do with someone that has Tricare for life or federal plans. They have no idea because they're not educated and they're not really an expert. Basically, I'm going to start with Tricare for life. Tricare for life, the way it normally works is it starts with you. You get your Medicare, your A, and your B. Now, normally people that have Tricare is retiree, basically, coverage from people that were in the military. Okay. I don't know the qualifications to get it, so don't ask me. I don't need to know the qualifications to get it. I just know how it works and how I can work with it. Basically, you have your Medicare, A and B. We've talked about A and B in nauseating detail, so I'm not going to talk about it anymore. But A and B is your primary insurance. Tricare is normally a primary insurance before you're on Medicare. But when you get onto Medicare, it goes from Tricare to Tricare for life. Anybody on Medicare knows what I'm talking about. Tricare for life then becomes a secondary. So Medicare pays 80% of your medical bills. Tricare pays 20% of your medical bills. Tricare doesn't cost anything. Tricare has no premium. Tricare is something that's awarded to people that have earned it. And I appreciate their service. Tricare covers prescriptions. It covers an array of different things that Medicare does not cover. It's like a super subsidy, but there's some things it pays for that Medicare doesn't pay for, where it's the primary, such as prescriptions and things like that. And they give probably the best prescription coverage you're ever going to find. Or right up there. I can't think of anything that might be better. Maybe VA. Maybe VA. Just depends on the prescription, I suppose. But basically, Tricare is not costing anything. It's giving you full medical coverage with Medicare, and it's coming in and covering your prescriptions. So what's to mess with that? Well, what I'm about to suggest doesn't work for everybody, but it works for a lot of people. I have a lot of happy clients that love what I've done with their Tricare that have done what I'm about to suggest. In some markets, this depends on where you are, but in some markets, we've talked about Medicare Advantage plans. You're able to take a $0 premium Medicare Advantage plan, run your Medicare through it, and Tricare will coordinate with it. A lot of people don't think Tricare coordinates with Medicare or a Medicare Advantage plan, but it does. Don't listen to people that say it doesn't, because it does. I have first-hand experience with it. And it does. It's documented. Look on Medicare.gov. It's right there. Basically, the way an Advantage plan works is it will cover everything that Medicare does already. So you're not losing anything by doing this. But the Advantage plan becomes the primary, let's say through XYZ insurance company. XYZ insurance company. It becomes your primary. It's a $0 premium, so you're not paying anything to do it this way. You're not paying any premium to do it that way at all. And then Tricare for Life coordinates with it. So the Advantage plan will pay for everything medically speaking except for a copay. Tricare for Life comes in and pays the copay. This only works with a $0 premium plan. Now, so if you're in a market that does not have $0 premium Advantage plans, it's not worth it. Now, here's the advantage to it, because basically what we've talked about so far is how it's exactly the same as Medicare. Well, big whoop. What's the point? The point is they all come with extra benefits. They almost always do. Make sure the plan you pick does, but they're going to cover vision coverage, hearing coverage. Some give you dental coverage. They pretty much almost all of them will give you a gym membership, whether Silver Sneakers, Silver and Fit, or whatever program they carry. There's a couple different ones, but they're going to give you a gym membership. I've seen people do this just to have the free gym membership. And it works like clockwork. It's beautiful and doesn't work any differently than Medicare would. And, there's other benefits. Some areas have stronger benefits than others. Now, this also only works if you pick up a program that covers all of your doctors. Because remember, Advantage plans have networks. But if you have a plan, if you pick one up that has a big network, a large network that covers all the hospitals in your area, 9 out of 10 doctors, then it's a perfect fit. Because it's almost like you don't have a network. If you have one that's travel friendly, if you have one that has a big network, this works beautifully. Because if you have a big enough network, it's almost like you don't have a network, plus you have all these extra benefits. A lot of times these $0 premium plans make you get referrals to see a primary care physician, but that's not a problem with Tricare for Life, because Tricare for Life makes you get a referral anyway. Tricare doesn't when it's the primary before you're 65. But Tricare for Life makes you get a referral even if you didn't have a plan that needed a referral. So it's almost, you have to go across that bridge either way. Basically, you have your primary care physician write 2 referrals at one time every time you need to see a specialist. And so don't let that referral scare you, because it's something you have to go through either way. So if there's a better plan for you that needs a referral, and there's one that doesn't need a referral, but it's not quite as good, go with the referral if it's Tricare for Life. But that doesn't work for everybody, because not everybody lives in a market where there's plans like that will fit that well. But in my market here in Utah, they definitely exist. I have, 50 plus clients that have Tricare for Life and an Advantage plan with me, and they're happy as a clam. Don't listen to an uneducated agent that just doesn't have experience with this stuff, that isn't skilled enough to know how to work with this stuff. If you work with the right person, it works easy. Stay with me. We're going to come back in the third segment and talk about VA and federal plans. Stay with me for segment 3. Segment 3 of the Everything Medicare Podcast. I'm your host, Christian Brindle, where every week I talk about your Medicare, your Medicaid, your Social Security, and everything that has to do with your retirement. Today we're talking about Tricare plans. We're talking about Tricare for Life, veterans benefits, federal plans, what it has to do with you. If you have it, what are your options? What are people not telling you? We talked about Tricare for Life in the last segment. Tricare for Life is something that 99% of agents that claim to do Medicare in the state of Utah, in whatever state you're in the United States of America, don't know what to do. I've had so many people that have been doing this twice as long as me, 3 times as long as me even, not know what to do. They've said, they've claimed to me, well, they don't work together. There's nothing I can do for that person. They're uneducated. They have no idea. Me doing this for 5 years, growing up around this stuff, having a father that was in Medicare for so long, I know this stuff. I know how this works. I have success stories. I have testimonials. I have clients. And it's right on the Medicare website. It's in every Medicare book. Is possible, and it can work wonders for you. Okay? Let's talk about VA. How does VA work? VA is very different. VA, and when someone has VA, veterans benefits, and Medicare, They're completely separate from each other. No, most of the time, there's exceptions to this. If someone's like on VA disability, it works a little differently. We're going to talk about just regular VA because that's what most people have. If you have questions about VA disability or anything like that, or Champ VA or any of those things, call my office. We can talk to you about it. Just go to our website, www.christianbrindleinsuranceservices.com. Give us a call. We'll tell you everything you want to know. But for now, we're just going to talk about regular VA. Regular VA basically works like this in most places. Not every state, but most of them. Basically, there will be VA facilities near you. Certain facilities. Usually there's not a whole lot of them, and sometimes you have to drive a while to get to them. With VA, it doesn't cost you anything, but as long as you go to a VA facility, you don't pay anything. You don't pay for prescriptions usually. So that's how VA works. It wouldn't work at a private hospital. It wouldn't work with a private doctor, a primary care physician, a clinic, things like that. You have to go to a VA facility. Now, I've heard some people say, I don't know this to be a fact, I've never been to one, but I have heard multiple people tell me over the years that VA facilities, just the quality of care isn't all that. It's not great. I've heard some people say it is, some people say it's not. So some people like the option of going to a private facility if they want to, having the option. Now, basically, if you have Medicare in VA, this is how it would work. Medicare would be all that you'd have. So if you went to a private hospital, let's say, Medicare would be all that would pay towards that private hospital. They'd pay you'd have your deductibles, your co-pays, they'd pay about 80% of the bill. You'd have a humongous out-of-pocket left over. VA wouldn't help you pay for a dime of it because they're separate. They have nothing to do with each other. All you can do if you have VA is you can pick up an Advantage plan. Same thing as with Tricare, but it works differently. Basically, you have the in-network coverage for the Advantage plan. And if you go to the hospital, you'd pay your copay. But it'd be dramatically better coverage than that of just Medicare if you ever wanted to go to that place. Now, if you will never go anywhere but the VA facilities, then this isn't necessary. I mean, having Medicare at all isn't necessary. Now, remember, if you decide to not take Medicare at 65 if you have VA, you'll get penalized if you pick it up later. So make sure that's what you want to do. But some people do that. And some people it works till the end of time. But that's what you can do with VA. Pick up an Advantage plan. I mean, you'll get all the extra benefits that you would get that if you had Tricare, and it gives you options to go to other hospitals if you choose to. You're not stuck just going to the VA facilities. It gives you more flexibility. I have a lot of clients that have VA that have Advantage plans that work this way, and they're happy. They like the options. They like the security. They're well protected. Okay. Last but not least, we're going to talk about the federal plans. The federal plans, it works exactly the same as Tricare for Life, folks. When someone has a federal plan, Federal Blue Cross, Federal Select Health, Federal Aetna, Federal Altius, whatever, Federal Cigna, doesn't matter. There's a lot of different federal plans out there. They're usually, had some type of federal job. It could be post office worker, could be a government employee, could be all kinds of things. But the way it normally works is Medicare A and B is the primary, the federal plan's the secondary. It works very similarly to Tricare for Life, except for they're not free. Federal plans cost a pretty penny. They're usually hundreds of dollars a month at premium. But if someone has one, unless they qualify for Tricare, I wouldn't drop it. I would always keep it because it's going to give you better prescription coverage than any other Medicare plan. We've talked about the donut hole in past episodes. Federal plans don't have the donut hole. They're a good fit, and you have full medical coverage. What I recommend is pick up an Advantage plan, same as Tricare for Life. You have all the same benefits. It coordinates with the Advantage plan. Boom. Same thing as Tricare for Life, folks. It sounds so simple, but most agents, 99% in the country, from my experience, don't know this stuff. Might make you question who you're working with on your plan, right? Think about it. Think about what I've said. Make sure you're working with someone that's educated, and don't let anybody work with you on your plan that doesn't know what they're doing. Thank you so much for being with me, folks. This is the Everything Medicare Podcast. I'm your host, Christian Brindle, and thank you for being patient with me, doing this on a Tuesday instead of a Monday. We'll be back next Monday. I hope you have a fantastic week, and Last but not least, if you're on social media, follow us on social media. Follow us on Facebook, Christian Brindle Insurance Services. Follow us on Instagram, Christian Brindle Insurance. No spaces. Follow us on Twitter, C Brindle, I believe. C Brindle without the E on the end. So CBRINDL. Follow us on Twitter. Follow our podcast here. Subscribe. Give us ratings. Give us some love, because I'm bringing you free information every week. Thank you so much. I love you guys. You're fantastic, and I'll see you next week.